Hey everyone, and welcome to a special edition of What's Next, a free webinar powered by the North Carolina Association of Free and Charitable Clinics. My name is Josh Jacobson. I'm Managing Director of Next Stage, a Charlotte-based social strategy and strengthening firm. And I just want to thank you for tuning in for today, the first part of a two-part webinar entitled Marketing Your Clinic. Let me move that title forward. With support from the Foundation for a Healthy Carolina, the North Carolina Association of Free and Charitable Clinics contracted with my firm to work with a number of rural and suburban free and charitable clinics over the last year to develop strategies in the wake of the pandemic and to begin to communicate their renewed value proposition to the community. Today, I am joined by representatives from one of the clinics that I worked with, the Hands of Hope Clinic in Yadkinville, North Carolina. So today, went past you there, sorry. Joining us today is Marty Driver, Executive Director of Hands of Hope Clinic, and Brittany Wissick, a community volunteer who has been working with Marty to get a basic marketing plan up and running. Ladies, thank you so much for joining me today.
Thank you, Josh.
Yeah, it's great to be here.
Yep, thank you. We're going to get back to both of you shortly. I have a little bit of content I want to do to sort of tee this up a bit. Again, we're going to unpack that Hands of Hope Clinic as a case study, but in this first session, we're going to talk a little bit about why marketing and communication is important, understanding your various audiences, and distilling some messages. Having worked with a good number of clinics now in both the urban, suburban, and rural context, you might be surprised to learn that marketing and communication has not always been top of mind for clinic leaders. I know Marty is probably smiling a little bit, wondering where we're going with this, but the reality is there's a lot of things to do on an executive director's plate, and sometimes that communication function is less prioritized. There's some good reasons why we would want to prioritize it, particularly if we feel that we are challenged to break through, to have people pay attention, to really understand the value proposition that our free and charitable clinics are providing. So it's important to market. Many of you very likely have websites that detail kind of what you do and why you do it. Understanding the free and charitable clinic sort of reason for being, what you do when you're open, information about how to access services that you're providing, often captured in a website. Hopefully, we're also pushing that out a little bit through some of our digital communication. But as we talked about kind of that value proposition, that's really important, particularly this year, as we've been better understanding how the pandemic has transformed our communities and the needs in our communities. Free and charitable clinics are an important gatekeeper organization, providing services to people who may not have access to other ways to get healthcare. And certainly during a tough year like this year, helping to keep those emergency rooms clear has been a big role that the free and charitable clinics have played. Making sure your community knows that you exist and that you're playing this important role is one of those prioritized reasons why you would market your clinic. And ultimately, it moves people to action. So if we're thinking about, why would we communicate? Well, part of it is that so that people know that you exist, so they know that you can come in as a patient. If they don't know that you exist, they may not know that they can come and engage with you. But increasingly, we have to be thinking about those stakeholders in our community, the civic leaders, the business leaders, philanthropic leaders. Right now, there is need all over our communities and being well positioned so that those civic and business leaders know what you do and why it's important. And these are some of the reasons why we would want to prioritize marketing anytime, but certainly this year above all. As we think about who our audiences are, who are we trying to communicate with? This is the first stop typically when we're thinking through a marketing plan, as we'll talk to the Hands of Hope Clinic here in a second, thinking about who are they trying to reach? And who are we trying to communicate with? Well, those current and prospective patients. There's the folks that we're currently serving, making sure that they know what we're doing and maybe are communicating with them about what we hope that they will do to have preventative care. That's an audience, but also all those folks that could be patients. Now, I know I've met some clinic leads who suggest, well, we're careful. We don't want to tell the world that we are open because we're afraid that we might have too much demand for our services and that we wouldn't be able to serve everyone. And to that, I would say, until you can demonstrate that there's need inside your community for what you do, it's going to be really hard to get folks to want to support it. And so having, a demand for your services is a good thing. I know it creates sometimes some challenge of just having to figure out how you're going to prioritize patients. But on the other side of it, that becomes a really strong argument to our community as to why you need to be open more, why you need more resources so that you can serve the need. Until you're documenting what that need truly is, it's going to be hard for you to make that argument. So we need to reach current and prospective patients. We also need to make sure that institutional partners and funders understand the role that free and charitable clinics play, particularly in this time of the social determinants of health. As we're thinking about the health needs being as much clinical as all the rest of the ways in which the people we serve are well positioned in the community for access to food and to housing. Often it's going to be the clinic that has a finger on the pulse of the needs of individual patients. And so getting to your community leaders and civic leaders to really understand the role that clinics play, that's going to be really important. Then, of course, current and potential volunteers and donors. So there's those institutions we're trying to reach, but there's also the individuals. And individual giving and support for your clinic is a need for any clinic. We can't be so reliant on grants and institutional funding that we miss the opportunity to build relationships with individuals. And that's often going to require us to think about how are we engaging them as volunteers. Now, you might look around your clinic and say, well, I don't have a lot of volunteer activities here inside my clinic, and that's fine. But we might want to think about how volunteers can be supportive of generating awareness. Just even sharing and liking your content on social media can be really important towards getting your word out to more people. So once we know our audiences, we have to start thinking, what are we trying to say to them? What are our messages? We're going to hear from Hands of Hope Medical Clinic here in a second about what they thought their important messages are. The reality is those messages are going to be different for different clinics. You have to take a look at your community and decide what is meaningful. What do we need to communicate? What does the patient profile look like? What's the information and service details that we need to make sure that people understand? To our partners and funders, we really need to understand where we fit into that larger world of supports for people. So we need to be able to articulate what's the need in our community. We need to talk about the model of delivery and how we fit together. Who are our partners and what is our place in the social good universe in our community? We also have to think about those human-centered stories of impact. And we have some great ones with Hands of Hope here shortly to talk through. But gosh, your patients are unique to you. How can you channel those stories? Either to have them share them themselves or to document them so that you can share them out on their behalf. Really thinking about volunteers and donors, we're talking about emotional connection. What are people emotionally connected to? Probably not the statistics of how many people you see on a day-to-day basis, but instead the individuals that you serve. Who are they? What are their unique situations? And can we better articulate the who is served and why the role we play is so important, not only to them, but to their families, to their companies, and to the community as a whole. These are individuals that serve a role inside society. And we need to do a better job probably of telling those stories as to why what we do, it matters. So that's just a little bit about sort of this focus on marketing your clinic. We're going to cover a couple other topics as a part of our next webinar. But for today, I'd really love to bring Marty and Brittany back forward because they've been involved over the last several months in an effort to develop some processes for their marketing activities, something we worked on together. And Marty, I'll start with you. Can you tell us a little bit about Hands of Hope Clinic, a little bit of background?
Okay, thank you, Josh. Yes, this clinic was started in 2012, and it was started by a person who had grown up in Yadkin County. We're a rural county. Only about 38,000 people live in Yadkin County. He was in nursing school, and he just had the idea that we needed a free clinic here in Yadkin County. And so he, with his wife and a group of volunteers, opened up a clinic in a small church in 2012. And they had a walk-in clinic in the evening. Folks would line up, all day to be there to get served that night. It was first come, first serve. And the volunteers would actually set up the clinic on Tuesday evening, see the patients. They would do lab work, they would do prescriptions, they would fill the prescriptions on site, and at the end of the evening, they would take everything down and stock it up and then be back the next week. So that went on for a couple of years, and there was more and more need. So they moved to a more permanent place with the help of a community health grant and started chronic care clinic with these folks to be scheduled. And folks with diabetes, high blood pressure started to see a provider on a regular and consistent basis. So that was a wonderful thing. They continued the walk-in clinics, so new patients could come in the evening, and that was ongoing until this past year. We actually have relocated, and you can see in the picture, we relocated with our county health department to a new facility that was refurbished. And share the same space. And the most wonderful thing is we share the same nurse practitioner. She works in the medical clinic every day except Tuesday. And on Tuesday, she's with us from 8 to 6. We see our chronic care patients, and also we see walk-in patients now during the day instead of the evening. And we have found that that works so much better for folks because we work them in as the day goes on, instead of them having to come in and wait all afternoon or wait in a line to be seen. So that's been a wonderful addition to our clinic.
Yeah, it's great. I know this is a really unique alignment, right? Being right next door to the public health clinic and that collaboration. Can you just talk a little bit about maybe the uniqueness of that as a structure?
Well, it's been great in that, first of all, our provider has a heart for this kind of work. And so she enjoys it. And with her being with us on Tuesdays, she sees a lot of folks who could benefit from being in the medical clinic on other days. She's aware of what we do on both sides. So she's very good at referring people back and forth, not only for the best health care, but also for the best efficiency and cost for these folks who can't afford health insurance, first of all, but then also are limited, to the other things that they need. They don't have the funds for it. So she has been such a wonderful addition to our clinic and also to the medical clinic, because our local hospital shut down about 6 years ago, and we don't expect it to ever grow to open up again. So anyway, it just makes it wonderful that we've got Jennifer to be with us, who knows both sides of the picture. And speaking of Jennifer, come here. Let me just let her head in. There's Jennifer. She's our nurse practitioner that we love.
Excellent, Jennifer. Thanks so much for popping in. We're doing a little webinar here, so thank you for being a part of this. We've been talking about just the strategic planning that we were doing, Marty, that included Jennifer and thinking about kind of the future, which included expanding access to have more days. Can you talk a little bit about the strategic vision for the clinic?
Well, it's funny, when you were talking earlier, Josh, you mentioned that it's kind of scary sometimes, because when you think about expanding hours and seeing more patients, that means more staff, and that also means more financial ability to do that. Mm-hmm. So it gets scary sometimes, but like you said, you have to, push on, because you've got to show the community that need is there. And so we were able to do that. In August, we actually added a half-day clinic to our hours. And we have a nurse practitioner who's bilingual. We've tried to schedule most of our non-English speaking patients with her on Mondays, and we have been amazed at the difference in our A1Cs for these diabetic patients. She's so excited about it. She keeps a record of it. You know, every time she sees the patient, she goes back to look and see what their A1C was last time compared to this time. And so far, every single one of those patients, their A1C levels have come down, which is wonderful.
Well, that's great. Expanding access, so important. Jennifer, we'll let you go. Thanks for popping your head in. Shoot. Funny, Marty. But yeah, growing access. So I know you have a goal of just being open more. The more you're open, the more you'll be able to serve people. But that's going to require more financial resources. That's going to require you to have more people, more funding. And so I'd love to kind of bring in Brittany to help a little bit, because she joined this effort to start thinking about how we might market a little more effectively to increase awareness. And Brittany, I might have buried the lead a little bit in the introduction to you as a community volunteer. Could you provide a little bit of your background as a resource development professional?
Sure. Thanks. I'm actually a director of donor relations at Forsyth County's United Way, but in the summer after the pandemic, moved back to my hometown of Yadkinville. And I've been working in nonprofit for over 10 years, and I've always felt that I've always given back via my job, but never experienced volunteering in a way that was fulfilling for me. So when I moved back to Yadkinville, I reached out to Marty and asked, how could I help? And one of the things that she said was, we can help with marketing strategies. And so Josh, you and I had connected and really went through some of the strategies that we had thought about implementing in the clinic. And so I'm so happy to be working with you guys. I've been volunteering with Hands of Hope for about 3 or so months now. But, you know, it was really a partnership between Marty, Josh, and I to see where the biggest need was. And that was certainly from a marketing perspective.
Yeah, Brittany, that's amazing. And I know folks tuning into this probably are wishing they had a community volunteer who with a background in fundraising who could join as a volunteer to come in and help in this way. You were instrumental to developing the marketing plan that came after our strategic planning. So Marty and our group worked together in early 2020 to try to pull that together. And then just in the last couple months, we've been working together. I wondered if you might share, Brittany, a little bit. We had talked about having some prioritized outcomes that we were looking for. Could you walk us through those?
Sure. So as we were talking, Josh, we really thought about what was important to our community and what is lacking at Hands of Hope. And the one thing that came out as a resounding sense was our value proposition of closing the healthcare coverage gap. So we know that some people are covered by insurance and some people are not, but they are on other special government programs. But where we're not seeing people get the biggest help is when they're not covered by either of those. So they fall in this gap, right? And those are the prime candidates to be seen at Hands of Hope. So that was definitely one of the things that we wanted to make sure that we communicated was Hands of Hope is here in our community to help close that healthcare gap coverage. So the other thing that we talked about was what are the biggest needs in our community as far as health is concerned? And some of this came out of a conversation with Marty, but I think we honed in on some via our conversation. And so those are comorbidity factors. So messaging about the fact that cardiovascular health, diabetes, and hypertension are some of the most serious issues in our community. along with behavioral health factors. Mental health and substance abuse is a big issue in Yadkin County. And we wanted to make sure that if we marketed anything, it was that when we see patients and we see their A1C go down, we oftentimes see their cardiovascular health improve and other comorbidity factors improve as well. So we're really doing such great work in the community to solve a number of problems. And then third, the clinic is really, it's not a handout because people have to do the work. They have to be advocates for their own health. We're here to help serve them. And so it's really a hand up for our patient population instead of a handout. And I think it's important to donors to see that patients are really advocating for their own health, and they're taking accountability for the issues. So when they're seen at Hands of Hope, they can really transform their own lives just with the help of having medical care for free. And then how individuals in the community are seen. So one of the things that we talked about, Josh, as I was looking through the website and some of the social media platforms for Hands of Hope, was the lack of patient stories and faces of the patients that are being seen. So that was something that we discussed that would be on high priority for our marketing strategy. So what we decided to do was do a series capturing patient stories. So I've already started doing this, and we've gotten a couple of patient stories written down, which I know you'll talk about later on. But I went into the clinic and videoed the patient story, got their consent for it to be shared, and we've been able to share that on our social media outlets. And when Marty goes out and talks to the Rotary Club or any other prospective donor or institution that wants to fund Hands of Hope, she now has a listing of patient stories that she can refer to and share via video and blurb. So we're really leveraging those stories in our community and having Marty share the great work that we're doing.
Yeah, it's excellent. And just having some clear direction, what you're trying to accomplish. So as you think about setting up a communication plan, then if we can be touching on these themes in some of the promotion that you're doing, then we're doing what we're supposed to be doing. It was great to get that clarity, and certainly your leadership in this has been so important. Marty, I want to ask you just sort of some of the audiences that we talked about wanting to serve and connect with. Can you talk us through how these different institutions and individuals relate to the clinic?
Yes, churches, we have a lot of support from churches in our community, Josh. Unfortunately, I feel like there's still a lot of churches that don't know about us either. And that's one of the things I would really love to get out of the clinic and get out in the community and make them aware of our free clinic. Companies, industries, and businesses in the area, I think they are aware of us, but I don't think they understand how important, and how essential we are to keep our community healthy, our workforce healthy. I'm attempting to, get that message out there the best that I can, but I don't think they understand that those folks who are working through temporary services, temporary agencies, they don't have health care. And if they're not healthy, they're not going to be able to show up for work. And I know that's a big problem in our community right now. They're having difficulty finding healthy employees. There are a lot of jobs available, but it's hard to find people that, are healthy enough to do those jobs. So I'm trying really hard to get to those temporary agencies and let them know that, we're available. I'm also involved in the community on the chamber board here in Yadkin County. I'm constantly trying to remind them about, what we're doing, what we provide. I know I had a call this week. It was so funny. It was from a local businessman who is retired, but really not retired in that he has bought a shredding company. And so he called me to say, we would like to come on site at Hands of Hope and do our next shredding event. Would you all be interested in anything over what we make? We will, donate, of course, to Hands of Hope. And I know that had I not been out and about in the community, that connection would not have been made. Oh, well, let's call Marty. Maybe Hands of Hope, would need that sort of thing. So it's just a constant, thing that you work on. But that's what I enjoy about being in a small community. A lot of people in the community, there's a lot of connections here. I know most of the community resources in like our food pantries. The things that people need, I can refer them because I have those connections, because I've lived here for a long, long time. And, that just makes it even more exciting when hey, I've got somebody I can call that will probably help these folks. So it's been a wonderful job experience for me.
Yeah. Well, I know we talked about during this, year of COVID, how hard it is to get out and do public speaking and connecting. Those meetings have not been in person, and just the challenge to have alongside it then, some digital communication, to have that social media, a digital newsletter that reinforces the good work that you're doing out connecting with audiences. That was really your unique marketing plan, what we call grass tops. That's the Marty's work, to go out and connect, get in front of groups of people, grass tops, and then grassroots, what we're doing through digital communication and social media. I really want to highlight, I was on your Facebook page just poking around a little bit. I really love the content you guys are putting out. It's really solid. I want to highlight a couple of Facebook posts from October where you had video testimonials from patients, which were just so good. And we're not going to play them here, but Marty, could you tell us a little bit about Bruce and Rosalinda?
Well, I'll have to say that's the thing I love about Brittany. She knows all the social media stuff and she can do this.
Yeah.
But she was so gracious to come out, I think on kind of her lunch break a couple of days, and take both of these patients. And they were eager to do this, and it was so exciting. Bruce came to the walk-in clinic a little over a year ago when we were at our old location. And he patiently waited until we could see him. And of course, we diagnosed him as pre-diabetic. He had high blood pressure. He was overweight, lots of things that we picked up on. Well, we prescribed medication, gave him some education about a healthier lifestyle, and encouraged him, to try to maintain that. And of course, scheduled him to come back. Well, he's been coming now for almost a year. And he is the sweetest thing. He's so excited. He's lost about 40 pounds. His blood pressure is down. So is his triglycerides and his A1C. Mm-hmm. So he's been so excited, to tell everybody that. In fact, he finally got his wife to come in just a couple of months ago because he felt like she needed to be seen at our clinic too. So we love Bruce. And then Rosalinda, she's a sweet lady who has several children. I think she has about 5 children and numerous grandchildren, and she babysits her grandchildren. She also was pre-diabetic and had hypertension. And so she was referred by our health department or medical clinic to come to Hands of Hope several years ago because they knew that she couldn't afford her medication and she needed health care. And so she's been coming to us now on a regular basis. She comes every 3 months, gets her A1C checked, do her blood pressure, get her medications, and she's good to go. And she will tell you she feels so much better.
Yeah. Brittany, I think about these 2 testimonials and how they tie back to those core messages. With Bruce, he's 59 years old and not yet eligible for Medicare. And so, we talk about that gap, and, here's someone who's in that gap, really good testimonial. And then this unique relationship with the public health clinic next door, and how that referral really works. How easy was this to do, Brittany, for people watching, how easy is it to put a testimonial up on Facebook?
Oh, it was super easy. So Marty worked to identify the patients, and she basically texted me when they came into the clinic, and she said they're available, they're ready to go, they're willing to share. And so she had them sign the appropriate paperwork to share their information. And what I did first was I came in and I met them and just talked through their story. I didn't go in and film them right away. I just got to know them. And then when the filming part happened. I did it with my phone, and we had them sitting down like a casual conversation. And I just said, now tell me exactly what we just talked about. And basically, with a little bit of coaching, we did both of these videos in one shot. Bruce is a talker. So it was less than 1 minute, which I was shocked, but they did fantastic. And it's really a testament to how much they appreciate Hands of Hope. It's very evident that they are so grateful for the clinic, to be in their lives in the videos. And basically, I could upload the videos from my phone. I worked with one of the board members who manages the Facebook page to be an administrator. And so basically, I can now upload content to the Facebook page. So that's really how it worked.
And pretty easy to do, it sounds like, and really impactful. I know it's sometimes hard to know how many people are actually seeing our content on social media. You kind of count the likes, but that's not everybody who sees it. What's interesting about video is it actually tells you how many times it's been viewed. So maybe it's surprising to know that each of these videos has been viewed 450 times, which gives you a real indication of how many people have been impacted, having, maybe spend some time listening to these brief testimonials. We would think they would have a much better understanding of the clinic. And I have this last piece too, which I thought was really savvy too. Often we're getting awards and such, to actually post it on Facebook, take a picture and post it. Marty, can you talk a little bit about this award? I know this was a recent award that you received, and can you give us a little bit of background on it?
Well, it was a shock, first of all, so I will tell you that. I happened to be at a county commissioner's board meeting one Monday night, and so was Jessica Wall. And Jessica's over the medical clinic, or the health department, and we've collaborated and partnered, through this whole thing, bringing this together. And in fact, we had something to present that night to the county commissioners, something else we wanted to do. But before we could get to that, there was this awards presentation, and Dr. Jeffries, I'm assuming he came from Raleigh, and his wife were there to award us with this nice plaque, and it's from the Association of North Carolina Boards of Health. It's the Robert E. Strother Award. And as you can see, it was presented to both of us for the outstanding accomplishment, dedication to community service, and a visionary approach to population health improvement. We were shocked and had no idea, but what happened was our county commissioners have been excited about our partnership, and one of them knew about the possibility of this award, and he insisted that our county manager nominate us for the award. And sure enough, we won. So, I mean, it was amazing, but, we were just so thrilled to have that, and have our hard work acknowledged, because it has been a lot of work, but we continue to strive to do the best we can for our community. We want it as healthy as it can be. And this is just another way to do it. And I think we are the only free clinic and health department or medical clinic in the state who actually are in the same facility together and are working this closely together. So we're pretty proud of ourselves.
It's dynamic. And that you would post it to social media. So, we often are the beneficiaries of these things, whether it's awards or recognition, that no one outside who was in that room even knows that it happened. To really be thinking about social media as a platform, and that if something good is happening, can we take a picture? Can we do a video? Can we capture this moment in some way so that we can share it with the rest of the community? That's the new way of thinking, to really be thinking first about after something good like this happens. I know, Brittany, that's something that you've been helping Marty do, to just be thinking about social media. I don't want to put you on the spot, but do you have any final advice or words of wisdom for the clinic leads that are out here now, who maybe are thinking about what they could be doing in their own communities?
Yes, certainly. I think there are a lot of people like me who are wanting to get involved with volunteering, but don't really know how they can help. And I think that being a Facebook administrator and being able to post positive things, I only post a post once a week. And it's very minimal work for someone like me. And so I think that's important to know, is that there are people in your community who are willing to do this work, and they may be just out there waiting for you to ask. And it's very minimal work on my end, and it seems to be pretty rewarding for the community too.
Darn right. Brittany, thank you. And yeah, all of you out there, go find your own Brittany in your community who's
That's
willing
right.
to put a little time and effort in, right? It's not a huge lift, but it is important and something that is helping a lot of people. So Marty and Brittany, thank you so much for taking time out of your busy schedules to come in and talk about the marketing plan and how you're creating content for social media. I know with Brittany's help, Hands of Hope Clinic will continue making that marketing plan a reality in 2021 and beyond. And I want to thank everyone who tuned into this session, the first part of a two-part webinar. Next time we'll have representatives from Grace Clinic who are just down the road in Elkin, North Carolina. So until then, thank you all for tuning in, and have a great one.